Hi, this is John Fallett with Senior Enrollment Solutions. Today we're going to be discussing the luxuries of your Medicare. Your dental, your vision, your hearing, and your prescription drugs. Your dental. By visiting the seniorenrollmentsolutions.com website, simply click or hover over the Health tab and click on the Dental tab. Through the Senior Enrollment Solutions website, we share with you that there are only two different styles of dental coverage. You're either purchasing a traditional plan or you're purchasing a fee-for-schedule plan. With a traditional plan, generally you're lured into that plan by having your cleanings, oral evaluations, and x-rays covered in full. However, keep in mind, you'll have a minimum waiting period of 6 months on your minor procedures, cavities, fillings, extractions, and a 12-month waiting period on your major procedures, crowns, bridges, partials, etc. You have to pay a premium for 6 months or in 12 months prior to the carrier paying for any of those procedures. With a traditional plan, understand that you're limited or you're capped on that particular plan, generally at $1,000 or $1,200 per year. You may have lived the horror stories or have heard of the horror stories where I needed 2 crowns. I went out in February and got 1 crown taken care of, but then went out the following year and got another crown taken care of. Well, why do you do this? Well, you did it because you capped your insurance and your plan's just simply no longer paying anything, even though you're paying a monthly premium for that coverage. With a fee for schedule, there's no waiting periods, there's no cap, there's no exclusions, and there's no limitations. What you're doing is you're signing, in essence, an agreement to pay cash for those procedures when you visit the dentist office. So it's a fee per schedule. You schedule an appointment, the dentist will know exactly what they're charging you, you know exactly what your costs are prior to visiting the dentist office, and in turn, everyone knows exactly what the costs are and there's no surprises that you capped your insurance, had a waiting period, or anything of that nature. Moving on to vision coverage. Vision coverage is oftentimes a very mistaken coverage when it comes to your Medicare. We do offer several different vision providers. Now keep in mind, with vision coverage, you're generally paying a premium of around $20 per month to get half off of your eye examination and typically 40% off your lenses and frames. 40% of retail cost is generally higher than what you're able to find your eyewear online. There's a slew of eyewear locations online to purchase your eyewear for less than $70. Perhaps thinking outside the box will save you money when it comes to purchasing your eyewear. Most carriers, however, when it comes to your supplemental plans, do not cover vision coverage at all. Your hearing. You can purchase an additional hearing plan. Typically, it will have a 12-month waiting period prior to allowing you to purchase any hearing aids at any discounted rate. They want a year's worth of premium dollars or 2 years worth of premium dollars out of you as a consumer prior to covering 50% of a hearing aid or a hearing apparatus. Keep in mind that several prescription drug carriers currently include a hearing benefit at no additional charge. It generally would behoove of you to purchase your prescription drug plan with a carrier that includes a hearing benefit as opposed to spending $40 or $50 a month for a plan that's not going to cover more than 50%. Mind you, it is capped or limited to $1,500 or $2,000 generally on what the carrier is going to provide you in a given year's time. By purchasing a prescription drug plan that includes your prescription drug coverage as well as a hearing benefit may save you a tremendous amount of time, money, and hassle in the event you are in need of hearing apparatuses or hearing aids. Your prescription drugs. Now, I understand you purchased a prescription drug plan or will be purchasing a prescription drug plan. However, keep in mind, throughout the year, your prescription drug provider may no longer carry that medication. It occurred in 2014 with Lipitor. Millions of Americans on Lipitor simply no longer had Lipitor covered on several plans. So what are your options? Well, you can either pay retail cost for those medications, You can change your medication, but unfortunately there are some side effects to generics or purchasing a different medication. You may ask your primary care physician if they have any samples that may help you get by for the next month or two or finish the year out. Senior Enrollment Solutions does provide you a free prescription drug card. It is automatically set up at every pharmacy across the nation. There is no cost to you as a consumer. It is simply put in place to assist you in not having to pay full retail cost. Simply visit the rxcut.com RxN00578 website, and from here we can either text you a card, you can print a card, or you can certainly shop for the lowest costs at the pharmacy. Once you reach the RxCut card website, search for the lowest price, enter your medications. We'll just simply use Lipitor as that was our example. We'll select Lipitor. We'll add this medication to our list. Choose our dosage. Enter our zip code. This will allow us to see the least expensive pharmacies in our area and what the cost will be for that dosage and that medication. Your traveler's insurance. Many consumers travel outside of the United States. Please keep in mind that Medicare will cover 80% up to $50,000 of foreign travel. Many Medicare supplemental plans do not cover foreign travel. Senior Enrollment Solutions offers the highest rated carriers to provide you your traveler's insurance experience. Simply visit the Senior Enrollment Solutions website, hover over or click on the Health tab, click on the Travelers tab, and simply watch the interactive video. For all things Medicare, visit us at seniorenrollmentsolutions.com, phone us at 877-777-5972, or email us at customerservice@seniorenrollmentsolutions.com.